Hi, I am Vanessa. I have been practicing as a healthcare professional for nearly half a decade now. I was tasked with an obligation to give insights into the essence of care coordination. Throughout my exhibition, I will define what care coordination is and its impact on the healthcare processes, and how nurses can apply ethical principles to promote better healthcare outcomes. As nurses, we are obliged to foster care coordination to facilitate healthcare services. We are all expected to provide patient and family-centered and group-based care tailored to evaluate and enhance the patient's dynamic needs while simultaneously helping patients navigate the healthcare system effectively. Care coordination refers to processes and activities that ensure the patient's dynamic needs and inclinations for healthcare services and data sharing and enhance effectively across the board. Numerous families, patients, and informal healthcare professionals have at one time experienced fiascos in implementing care coordination in the healthcare setting. Kawakowski, 2019. Communication is key change management aspect since it allows for collaboration on distinct healthcare-related issues. Any execution of change management in the healthcare constitutes aspects such as planning communications and consolidating many teams of modification champs and also assessing the enthusiasm for the change and modification. Having a robust and competent leader is essential to offering proper quality care services. Miller, 2019, notes that the leaders define the roles of the workers and ensures that there is education, communication, and skills to work out the barriers that could lead to effectiveness. Organizations that have robust culture that promotes openness, investigations, and ingenuity among members. Such organizations allow the members to obtain synthesis and share information, offer the liberty and cultivation to explore things, to risk letdowns, and acquire from blunders. Essentially, care coordination promotes patient satisfaction of care and strives to minimize the healthcare-related costs and improve the health results simultaneously. Many healthcare organizations are undergoing a robust transformation to reform their activities, entailing a shift to a value-based repayment approach that compensates healthcare professionals for adequately managing people's health. To fully address the emotional health of people, adherence to care coordination is much needed. While managing care coordination requires proper and sound communication between among the team members, healthcare professionals, it also involves offering patient education at all levels appropriately and conveniently. Care coordination also entails establishing plans that provide medical attention to the patient's unique conditions and uncover obstacles that may avert them from conforming to the care plan. Proper care coordination matters not only on a larger scale, but it is essential to attain the reforms that all people eligible to the healthcare system require. Miller, 2019. Through the effective coordination, trust is established between the patients and the nurses or healthcare professionals. Therefore, the caregivers are empowered and they are motivated to contribute to the success of health outcomes. A proper nursing process is used to synchronize plans for routine activities. The nursing course considers a collaborative and personal model with problem-solving and decision-making process that acts as a basis for the provision of nursing care. It encompasses gathering data, uncovering the patient's needs, identifying the objectives with significant and quantifiable results, and adopting personalized nursing treatment models to help the patients attain the intended purposes for workable products. Kawakowski, 2019. In addition, collaborative care constitutes of the whole teams and proper care coordination. The care team consists of physicians, nurses, dietitians, social workers, caseworkers, therapists, care techs, and pharmacists, among other people who can work together with the patient on the patient's healing process. Miller, 2019, identifies the key elements of care coordination as good communication and operative care plan transitions among the providers, precise and straightforward data understood by the patients, a specific focus on the aggregate healthcare prerequisites of the patients, easy admission to a wide range of healthcare services and healthcare professionals. The first care coordination and primary care coordination entails offering care and preventive health for the patients associated with acute conditions and issues. Johns Hopkins University points the guided care model to address the ever-present hurdle of handling and managing the aging people in the United States. When all the health professionals effectively use the model, as mentioned above, patients, healthcare professionals should jointly coordinate to offer sufficient care that is patient-centered approach. The second step of care coordination is acute care coordination, which puts into the patients with severe healthcare problems. For instance, heart attack, obesity, and stroke. Such patients should be subjected to emergency care services. With deprived communication systems, cases of medication errors and services compromise with the healthcare systems. When the healthcare professionals foster proper communication amongst themselves, healthcare outcomes are highly improved. In such a care coordination system, the transition of care programs that consider the treatments, follow-up appointments, and proper drug prescriptions are disseminated and documented at an ideal pharmacy, Miller 2019. An appropriate way of giving instructions is given to the patients and the health professionals providing the care and the family members. The most outstanding goal is to ensure effective transitions of the care programs to minimize extreme cases of increased hospital readmission rates, among many other issues. The third step of care coordination is post-acute or long-term care coordination. The post-acute therapies are ideal for the patients from acute care to enhance the seamless transition to home and build their strengths. Some patients may leave the facility fruitful, and some may require additional care programs to gain more power. Kawakowski, 2019. In an effective care approach, accredited care coordinators enhance proper transitions between the clients and the family members to allow the patients to concur with the same platform with the care plans and the care prospects. It is important to note that some patients may lack family members. Hence, it is essential to include the family members and relatives to ensure adequate care. This is due to the essence that some patients may lack proper communication skills. Miller, 2019. Nurses should ensure that communicate properly with the patient's family members to enhance appropriate rapport and collaboration to avert other devastating extreme complications and attain proficient health concerns. Proper communication between the healthcare professionals and patient is key and vital for the eminence of healthcare. Numerous culturally diverse patients tend to offer communication hurdles for the care delivery, particularly on the social cultural variations which are not wholly acknowledged, explored, and comprehended. The apprehension that comes with the interacting and collaborating with people from diverse culture has a significant effect on the individual's extent of involvement in the intercultural communication. Kawakowski, 2019, confirms that interprofessional collaborative practice integrates both the providers, the patients, and their families, is vital to meet the patient's dynamic needs. In effect, it brings about a chance for a wide range of ideas, compromises, and considerations to avert issues such as miscommunication, costly errors, and reworking, among many other blunders. Through collaboration, proper transfer of knowledge, information, skills, health outcomes, and quality care is immensely attained. When regarding the prerequisites of care coordination, the healthcare professionals' codes of ethics are put into account. With proper adherence to the ethical principles, each patient's moral principles, respect, and dynamic needs are respected by the healthcare professionals. Janich and Ariola, 2017. Ethics motivate the nurses to exhibit high-level competence and adopt practical strategies, patients' values, and health proficiency to augment proper care coordination. Health education significantly increases good health results. According to the Patient Protection and Affordable Care Act 2010, Title V, health education involves the patient's ability to obtain, disseminate, synthesize, and comprehend fundamental health data and services to influence appropriate healthcare decisions and choices. Laird, 2020. More often, the primary nurses and bedside nurses can ascertain the patient's potentiality to comprehend the learning mode that would advance proper retention of information to affect people's healthcare results. In summation, joint care coordination is an outstanding factor for the underway and the most effective way to permit patients' results. This information will be imperative to be considered by all of you, especially when implementing care planning for our patients. Thank you for listening. And in case you have any questions, do not feel shy to contact me. Are there any questions? Great, thank you.